different types of EHR developments were from academic medical centers, the government, and industry. The goal is to gather patient information for physicians to easily view it.
What else can you tell me about the evolution of the EHR?
Well, early efforts began in the 1960s when academic medical centers developed their own systems. Leaders saw benefits and began organizations to ease the use of EHR. The first EHR systems were known as Clinical Information Systems. Mid-1960s, Lockheed developed such product which has been handed down to many vendors. It influenced later systems because its processing speed, flexibility and flexible vocabulary. It also allowed many users to enter the system and view patient information at once.
Well, thanks Sally for schooling me on some history of the EHR system. I can't wait to share this information with my coworkers. They're going to be stoked. Hey guys. My name is Michael and I am the new IT support tech. I am looking forward to working with everyone. Please introduce yourself.
Hi. I'm Nurse Janet and I am pleased to meet you. I have heard so much great things about you and your wonderful work ethics. I'm sure working with you will be so exciting.
Hello, I am Dr. Smith. I am so glad that you are here, and can't wait to see what you have in store for us. I hope that you can bring a change to our IT support system. Well, hello. I see you have saved the best for last. Haha. I am Dr. Brown, and I'm sure it will be a pleasure working with you. I have such good thoughts already.
So Michael, I've heard that you already have some plans in sight as far as new systems and etc. Would you mind telling us about what you have in store?
Well, yes, sure, Nurse Janet. I don't mind at all. Yes, it is true what you've heard. I do have a lot of plans and new systems in sight. If you guys don't mind coming over to my office, I will gladly show and tell you some of my plans and big systems I have been working on just for you guys.
Oh, yes. Sure, I don't mind walking over it all.
Me either. I'm actually very anxious to see what you have to show us.
Alright now y'all. Less talking, and let's get a move on over there.
Dang girl, chill. We're getting there. Alright, let's move on now, guys.
Dude, like totally don't worry about it. She's about her business, as you can see.
Yeah, like for real.
Anyways.
You really have to excuse her sometimes, she bad and bougie.
Alright now, let's go. Well guys, welcome to my office and IT room. Meet my two IT assistants Ron and David. Hi everyone, I'm Ron, and I'm David. Well, first let's take a look at the new electronic health record system I came up with. It will also be known as EHRs.
Oh, cool. Sounds like fun already.
EHRs are real-time, digitized versions of traditional paper-based medical files. Digital medical records are cloud-based systems, meaning that the information entered into the electronic medical record software is stored in secure, remote servers to ensure patients' privacy and system reliability. All EHR systems allow authorized users access to patient records via the internet on a variety of devices including desktop computers, laptops, tablets, and smartphones. Each user is issued a password that allows them to log on to the EHR website, where they can view and make additions to a patient's file.
Wow, this already sounds good and so much better than paper-based charts and records.
Yes, indeed, it really does sound great. I honestly don't need to know anymore.
Well, hold on guys. There is a couple more details you need to know about EHRs. I'm not finished just yet.
Yeah, tell him. Dang y'all. Let the man talk.
Anyways, go ahead bro. We're listening.
Okay guys, back to them being better than paper-based charts and records. Virtually all medical reporting, documentation, and correspondence can be completed using an EHR system. Being that these systems operate in real time, any entries into a patient's electronic file are automatically updated and available for viewing by authorized service providers such as physicians, nurses, therapists, and pharmacists.
Excuse me, Michael, are there any benefits to EHRs?
Oh yeah, there's plenty. Thanks Ron. There sure is. I was just getting to that point. Matter of fact Ron, How about you explain some of the benefits? All right, sure. Some benefits might include physicians and other healthcare professionals having instant access to the patient's complete medical history, including allergies, test results, and diagnosis. Also, providers from different healthcare organizations can access a patient's EHR, enabling coordinated services while reducing expenditures due to redundancy. EHR can be linked to an electronic prescribing system to reduce prescription errors and fraud. It also protects from loss, theft, or damage. Funding for EHR adaptation is available from the federal government through the Recovery Act, which provides financial assistance to hospitals, clinics, and private practitioners who want to transition to paperless patient records. Thanks, Ron, for sharing that information with us. David, can you get the devices they will be using? Sure, just give me 1 second and I will get right to it. So what do you guys think?
I'm loving it. I can take mad selfies.
As you can see, you all have tablets. They're portable, easy to use, and allows information to be quickly accessed through the touch-sensitive screen. These tablet computers make effective displays for test results such as ultrasounds, X-rays, and MRI scans, making it easy for healthcare providers to quickly review important patient information while beside the patient as well. Any questions before we move forward?
No.
Nope.
Not at all.
Alright, now let's take a look at how our nurses and doctors will deliver this to our patients. Good afternoon, Flo. My name is Dr. Drake. How are you?
I'm doing fine. What about yourself?
I'm doing pretty good, thanks for asking. What can I help you?
I'm just here for my checkup, waiting to be seen.
Alright, right this way. Hey, Dr. Sanchez, Flo is here and ready for her checkup. Can you get her signed in so she can wait to be called?
Sure, Dr. Drake, no problem. All right, Flo, now that I have all of your information, let me guide you to your room in which you will receive your checkup.
Okay, sounds good. Thanks for your time. Bruh, can I please sit down, Dr. Smith? I've been standing up for forever.
Oh, of course. I apologize about that. Here, have a seat on the patient bed.
Much better. But before we get started, I have a few questions about your EHR system.
Sure, Flo. Feel free to ask me anything.
Okay, Dr. Smith. Well, what exactly is an EHR system?
Well, Flo, an EHR system is an electronic health record that is a computerized collection of patients' health information, like hospital charts. EHR patient files are divided into sections where healthcare providers and staff can find the information they need to provide the patient with care.
Oh, okay, true. Well, what made healthcare facilities start storing patients' information electronically?
Well, see, Flo, not that long ago, doctors and nurses would write notes in a patient's chart using paper and pen during office visits. Then those notes would be added to the patient's medical file, which were physically stored, until medical records were implemented.
Oh, okay. Well, how is patient information accessed then?
Most hospitals have their own unique EHR databases that are set up to be accessible from every computer. To open a patient's health record, a doctor, nurse, or other healthcare provider would log into the system with a username and password or thumbprint identification. Often, providers can access information remotely, such as from an off-site computer, by logging into their work's network system using the internet and accessing the EHR.
Also, what are the benefits? What are the benefits of an electronic health record system?
Well, it can safely store data, prevent medical errors, save time, save space, and it also empowers patients.
Well, is patient privacy protected?
Yes. Federal law called HIPAA identifies who is allowed access to medical records. HIPAA protects any information that healthcare professionals put in the medical record, conversations between doctors and others about your family's care or treatment, information about your family and the health insurance carrier's computer system and billing information. So you shouldn't worry if, for example, your nosy neighbor happens to work in the same hospital where you receive treatment. HIPAA bars anyone from snooping into patient records.
Wow, that is awesome. I am glad that EHR Systems exist. I am more confident now than what I was before. I really appreciate your time, Dr. Smith.
Anytime, Flo. That is why we are here to help you in anything we can. Just know that your information is protected and you are able to discuss anything you want with us.
Once again, thanks, Dr. Smith. I hope you have a wonderful day.
Thanks, Flo. You too.